Okay, let's unpack this. Today we are taking a deep dive into a really specific, really important medical condition we see in dogs and cats. Veterinary pulmonary contusions.
Yeah, and what we're basically talking about here are lung bruises in pets. This material we're looking at comes from excerpts of a veterinary text, focusing specifically on this topic. It's a pretty critical issue vets deal with in ER situations.
Usually from significant trauma, right?
Exactly. Usually some pretty significant trauma involved.
Right. So our mission for you today is to pull out the most important knowledge nuggets from this text. We want you to understand what these lung bruises are, how they happen, why they're serious, how vets figure out what's going on, and, well, what the approach to treatment and outlook looks like, according to the source anyway.
Yeah, what does this all mean for you, whether you're a pet owner or just, curious?
Let's dive in. Okay, let's start with the basics. The source defines these as hemorrhage, basically bleeding happening inside the lung tissue itself.
That's right. And this happens because of tearing, maybe crushing of the lung tissue during direct blunt trauma to the chest. So it's not just like a bruise on the outside you see.
Right.
The bleeding is deep inside the lung tissue, what vets call the parenchyma. And what's really fascinating here, and a super important point from the text, is that even, relatively small amounts of blood inside the lung can seriously mess up its ability to function properly.
Its ability to get oxygen around the body.
Exactly. Markedly compromise oxygen exchange.
So we're talking serious internal damage from trauma, even if it doesn't look that massive from the outside sometimes.
Precisely.
Okay, so how do they happen? The source is pretty clear. It's almost always about blunt trauma. Think car accidents, falls from a height, even, sadly, abuse. If a pet has that kind of history, even if they seem okay at first, pulmonary contusions have got to be on the suspect list for the vet.
Absolutely. And the signs you might notice, they directly relate to the lungs being damaged and, struggling to get oxygen into the blood. The text lists things like fast breathing.
Tachypnea, right?
Tachypnea, yeah, that's the term. Abnormal or really labored breathing effort. Sometimes they even adopt strange postures, like extending their neck out, trying to get more air in.
Okay.
And then cyanotic or pale gums, that bluish or pale color indicating a lack of oxygen. Those are really critical signs to watch for.
And the text also mentions what vets might hear, right? Like with a stethoscope.
Yeah, exactly. Listening with a stethoscope, they might hear harsh sounds, maybe crackles in the lungs. The pet might even cough up blood or like blood-tinged frothy stuff.
Wow.
Yeah, and because it's caused by trauma, you'll often see other injuries too, right? Broken bones, scrapes, wounds.
Sure.
And the animal might be showing signs of shock, which, raises a really important challenge for the vet. How do you know for sure the breathing problems are just from these lung contusions?
Or if it's something else caused by the same accident.
Exactly. Something else going on too.
So this is where the text gets into the diagnostic process. How do vets actually piece it all together? It gives a list of things they need to kind of work through and rule out.
Yeah, the source really emphasizes looking at other conditions that can cause similar signs, but maybe the problem's in a different spot or has a totally different cause. For instance, is it blood outside the lung in the chest cavity? That's hemothorax.
Okay.
Or is it air outside the lung, pneumothorax, which makes the lung collapse? And the text notes vets listen carefully for different sounds in different parts of the chest to help sort that out.
Like dull sounds versus maybe more resonant sounds.
Kind of, yeah. Dullness suggests fluid or air displacing the lung. Or could it be a diaphragmatic hernia where organs from the abdomen get pushed up into the chest cavity? That's something they'd usually look for on x-rays.
And the source also mentions other possibilities, things that aren't directly trauma-related but might look similar.
Right, things that cause lung bleeding or breathing difficulty but aren't from a direct hit, like a bleeding or clotting disorder, coagulopathy, maybe certain cancers or heart failure. Even severe infections like pneumonia or fluid buildup, edema that wasn't caused by the trauma itself. Lots to consider.
So how do they figure it out among all these possibilities? The text lists the key diagnostic tests.
Yep. Standard blood work is usually a starting point, a CBC, a complete blood count. That can show anemia if there's been significant bleeding.
Right.
And a biochemistry profile gives a bigger picture of organ function, maybe shows signs related to blood loss or damage elsewhere.
And then the imaging seems crucial. Chest x-rays.
Oh, absolutely crucial. The source says vets usually see this kind of patchy pattern in the lungs on the x-ray that represents the areas of bruising and bleeding.
Okay.
It might be in specific spots or more spread out, but often it's worse right over areas where there are also broken ribs.
Ah, that makes sense.
Yeah. And the text really stresses, You always do x-rays after stabilizing the patient first. They're so important for ruling out those other big things we mentioned, like the hemo or pneumothorax or a hernia.
Got it. Are there other specific tests mentioned?
There are. The text mentions coagulation tests if they suspect a clotting problem isn't letting the bleeding stop. And pulse oximetry or arterial blood gas analysis, these are huge. They directly measure oxygen levels in the blood.
So you know exactly how badly the lungs are affected.
Precisely. How well they're functioning or not functioning despite the injury. Sometimes they might even look at fluid from the airways, a tracheal wash, to check for too much blood or signs of maybe an early infection.
Okay, so once it's diagnosed, pulmonary contusions, what does the text say about treatment? It sounds like these are usually serious enough they need to stay in the hospital.
Oh, absolutely. Intensive care, usually.
Yeah.
The core of treatment, according to this source, is all about support. Supporting the animal's breathing and stabilizing their whole cardiovascular system, especially if they're in shock from the trauma. And if there's also that collapsed lung from air outside it, the pneumothorax, the text says draining that air immediately is step one. Thoracentesis, it's called.
Yeah.
Beyond that, it's about managing pain, keeping them calm, minimizing stress, and just constant careful monitoring.
What about specifics like, say, oxygen or IV fluids?
Yeah, the source emphasizes oxygen therapy for basically any patient showing low oxygen levels or having obvious difficulty breathing. For the really severe cases, they might even need help breathing with a machine.
Like intubation and a ventilator.
Exactly. Intubation and what's called positive pressure ventilation. And for shock, yes, fluids are generally needed to support circulation. But here's a really critical nuance the text points out, and this is a key knowledge nugget.
Okay.
Vets need to be really conservative with giving IV fluid.
Conservative. But you usually give lots of fluids for shock. Yeah.
You do, typically. But here's the problem. Giving too much fluid can actually make the lung problem worse. It can push more fluid into the already damaged lung tissue. And create or worsen fluid buildup, pulmonary edema, making it even harder for them to breathe.
Wait, so the standard treatment for shock could actually harm the lungs in this specific case. That sounds incredibly tricky to balance.
It is. It's really tricky. It's one of the major challenges. Think about it. The tiny blood vessels, the capillaries in that bruised part of the lung are already damaged and leaky from the trauma.
Okay.
If you suddenly pump up the blood volume by giving lots and lots of fluids, you increase the pressure inside those leaky vessels. And that higher pressure basically forces more fluid out of the vessels and into the lung tissue itself.
Making the edema worse.
Exactly. Worsening the edema, making breathing harder. So the vet team has to walk this really fine line, balancing treating the body's overall shock and circulation needs while trying to protect the injured lungs from getting overloaded with fluid.
Wow. That just highlights how complex managing these cases must be.
Mm-hmm.
The source also mentions maybe needing blood or plasma transfusions.
Yeah, if there's been really severe bleeding or if there's one of those clotting problems making things worse. And nutritional support, too, if they're not eating for a while.
And medications. Besides pain relief, what else?
Well, oxygen, as we said, that's primary. The text also mentions potentially using medications to help pull off excess fluid low-dose diuretics, like furosemide.
Okay, but didn't we just talk about being careful with fluid volume?
Exactly. So there's a huge caveat here. Building on that tricky fluid point, the text is crystal clear. You only consider diuretics if there's definite evidence of fluid buildup, the edema happening on top of the bruising, and the breathing distress is severe. They are absolutely not for routine use early on. In fact, they could be harmful then because they decrease blood volume.
Which is the opposite of what you want for shock.
Precisely. The opposite of what you need when you're trying to treat shock. So very cautious, specific use only.
Got it. So what happens after the initial treatment and hopefully stabilization? How are these patients monitored?
The source details really careful, constant monitoring, things like watching their breathing rate very closely, how much effort it's taking them to breathe, checking their gum color frequently.
Looking for that pink color.
Right, looking for good pink color,
Yeah.
checking heart rate, pulse quality, is it strong or weak, and listening to their lungs sounds often with a stethoscope.
Okay.
They'll also track blood tests, like the PCV-packed cell volume, measuring red blood cells, watching for ongoing bleeding, and checking total solids in the blood, too. Pulse oximetry or blood gas analysis to keep tabs on oxygen levels is key, especially, the text says, during that critical first 24 hours.
Makes sense.
It even mentions ECG monitoring sometimes to watch for any heart rhythm issues that might pop up, maybe from low oxygen or the trauma itself. And they might repeat x-rays after a day or two to see if that bruising pattern is starting to clear up.
How long does recovery usually take, according to the text? Is there a typical timeline?
This is another really, really important nugget from the source. Respiratory function can actually get worse. Yes, worse. During the initial 12 to maybe 24 hours after the trauma first happened.
Even after they get to the vet and start treatment?
Yes. It's a known phenomenon with these injuries. So that first day is a super critical period for close monitoring because things might look like they're heading downhill before they start getting better.
Wow, that's crucial for owners to understand if their pet has this.
Absolutely. After that initial potential worsening phase, though, improvement should gradually begin. The text says clinical signs, the breathing effort, etc., typically get noticeably better within about 48 hours. And the bruising you see on the x-rays, that should generally resolve over, say, 7 to 10 days.
Okay, so watch closely for 24 hours, look for improvement by 48 hours, and longer for the x-rays to clear. What if they don't start improving after that 48-hour mark?
Good question. If a patient isn't getting better clinically after about 2 days, the text says vets need to actively look for complications or maybe other injuries that were missed or are contributing.
Like what kind of complications?
Well, the source mentions bacterial pneumonia as a possibility. It's listed as less common, but it can happen. Maybe because the trauma itself plus the shock can kind of weaken the immune system's defenses in the lungs.
Okay.
Developing a wetter cough or fever might point towards that. Another one mentioned, also less common but very serious, is ARDS, acute respiratory distress syndrome. That's a severe inflammatory reaction in the lungs, sometimes triggered by severe shock.
Got it. And prevention.
Yeah.
I assume the source mentions trying to prevent the trauma itself.
Yeah, briefly, it basically just notes that prevention involves, common sense things like appropriately restricting an animal leash laws, secure fences, keeping cats indoors, basically preventing the accidents that lead to this kind of trauma in the first place.
Right. Wow. Okay, that was a really thorough deep dive into veterinary pulmonary contusions. We've covered what they are, basically those lung bruises from trauma, how significant trauma causes them, the really critical signs to look for, how vets diagnose them using tests and imaging, importantly ruling out other things, and those really complex aspects of treatment, especially that incredibly important, almost counterintuitive balance with IV fluids.
Yeah, that fluid point is key.
And we also looked at the typical recovery timeline, highlighting that potential initial worsening phase and what complications might pop up.
Yeah, it's really clear from this text that these are serious, serious injuries. They need vigilant monitoring and very careful, sometimes delicate management, particularly in those first 24, maybe 48 hours. Recognizing the signs quickly after any kind of trauma and getting immediate veterinary care is just crucial for the best possible outcome.
Absolutely. So based on all this information we've unpacked, here's something to think about. Given that we now know respiratory function can actually get worse after the traumatic event, even after initial assessment, what does that tell you about the importance of continuous observation and maybe proactive intervention, even if a pet seems relatively stable right after an accident?